Hello, kings and queens and everyone in between. My name is JJ and welcome to ScinKraft. I'm really excited today because today we have a guest with over 11 years experience in the medical aesthetics industry. She's a phenomenal advanced injectable specialist and trainer and a well-educated laser specialist. Today we're going to be diving into some of her advanced techniques when it comes to injectables, lasers. We're going to find out which filler is her favorite for lips, cheeks, nasolabial folds, and she's going to be breaking down which laser platform is most suitable for acne scars, anti-aging, stretch marks, and more. With over 11 years experience in the industry and countless celebrity clients who have fallen in love with her work, please help me welcome Pamela Anderson. Okay, hey guys, this is Nurse Pamela Anderson. So nice to have you on today.
Yes, I'm happy to be here.
Appreciate you. So today we're going to be getting into quite a few topics that I think a lot of people might be interested in, and you are certainly well credentialed to speak on. So I'm excited to dive in with you and get your thoughts on everything.
All right.
So why don't you start by telling us a little bit about your experience and background and your nursing degree?
All right. So I've been in the nursing industry for over 28 years. I graduated in the Philippines and I worked initially in the OR for a couple of years and moved out here. So I'm not going to sugarcoat it. Why did I go into nursing? Well, I'm Filipino, so my mom told me.
I know a lot of Filipino nurses, and they're all amazing at what they do with the best bedside manner.
Yeah, we do have the best bedside manner, and we do really care about our job. So I've been a nurse for over 28 years. I graduated in the Philippines, and I delved into the OR for a couple of years, and then decided to move here to the U.S. to try my luck.
You got lucky. You got real lucky.
I have to say I did, and it was because of my batchmate back in college, where she reached out to me and told me, "Hey, Pam, we have an opening at a dermatology clinic. Would you like to try out?" And I said, "Okay, why not?" And I've never had any experience with dermatology or aesthetics before, and I feel like it's going to be a chill environment. Wrong. It was wrong.
Sorry.
It was the busiest practice I've ever worked for. So I work for Dr. Lancer. He's a well-renowned dermatologist. I've learned so much from him. I enjoyed working with him and the rest of the staff, and I was there for several years until I decided to change my path a little bit and spread my wings in the aesthetic industry.
And that actually brings us to when you and I first met. So Pam and I actually first met working for another very well-known plastic surgeon in Beverly Hills. And it was actually my first job directly out of COVID, and I was fortunate enough to meet Pam during that time. Pam and I were hired on for the med spa portion of a plastic surgery clinic, and we sort of just really clicked. We both had very similar work ethic, and we quickly found out that we worked really well together. So how did you find our experience working together?
Well, it was a very good experience for me because I've never worked with anybody before as a consultant, and I feel like we did mesh really well. Our time together, seeing patients, he usually consults before I go in.
Yeah.
He vets the patients and makes sure that he understands what their needs are, what they're coming in for. And then he calls me from the nurse's station and says, "Hey, Pam, there's a patient right here," and blah, blah, blah. And I go in, I talk to the patient, I consult, and exactly what I recommended to the patient will be what he has already told them.
We were lockstep together.
Yeah, it's almost like telepathic. And
yeah.
I kid you not, he doesn't brief me on anything. He just tells me this patient is this and this and that. This is what they want.
I always found it best to respect the line of education between us. Me going into pre-consult just to get preliminary information from the patient as to what their concerns are. Certainly I'm not in there to diagnose anything. That's your job. So I made sure to toe that line with you, but I think we did it really well.
Yeah, I totally agree.
So when working together, I got to know your approach to medical aesthetics and treating the various signs of aging, as well as acneic clients and so on and so forth. Give me a little bit of an overview and understanding of what some of your favorite services are and what you're really talented at.
Well, I would probably say, it's kind of hard because aesthetics is so vast. Obviously, injectables is always going to play a big part of it.
Yeah.
I like doing full facial rejuvenation when it comes to injectables. I'm very conservative, so I don't do, all the rejuvenation all at once. I want the patient to come back every couple months, and see where we need to tweak it here and there. But as far as treatments, I would say lasers. Resurfacing.
Love a laser.
Pigment, deep wrinkles, tightening. That's what I like.
Tightening, toning, all the above. Absolutely.
Yep.
I would say the one thing that I really appreciate about your approach to aesthetics is when utilizing fillers and biostimulators for facial balancing, what I noticed is you address the entire face, but you use very minute amounts of filler, which I really liked. But it's really important that when treating a specific area, let's say the cheeks, by replacing the volume, you can then see that there are other areas that are in deficit. And so a little bit here and there just to make the whole puzzle come together, and you've nailed that.
Yes.
And I think that's why you've built such a great retention with your patients.
Yeah, I hope so.
I mean, they were always coming back asking, "Where's Pam?" If you were out sick, which was never.
Yeah, I know.
If you were out, where the hell's Pam? Okay, pivoting now, I would like to know, what is one of your biggest challenges when consulting with patients in the room?
I think it would be for patients who want to rejuvenate or transform right now, right there. That's a big challenge,
Yeah.
because especially if we're doing to restore volume or improving texture
Or tightening.
Oh my goodness, that doesn't happen overnight.
No, it doesn't.
And so for me to educate them, I always say, I'm not a salesperson, I'm an educator. So I educate them on what they need, what would be the order of treatments that they need to, go over,
Right.
and what's a priority.
Yeah.
That's the most important thing. And if they're patient enough to wait for the transition to happen and the transformation to happen.
I concur. One of my biggest challenges is having somebody in front of me and they want all the goals and all the results right up front, and they want it immediately. And that's how people look unnatural. I can sell you everything we have to offer, but I would not feel good about that, because I'm not about to put 10 syringes of filler in your face all at once and a million different laser applications all at once. It's definitely a slow and steady wins the race situation. And I say this all the time.
Yes.
Slow and steady wins the race. And that's actually something I really appreciated about working with you. When I was first getting to know you, I could quickly see that you and I were on the same page about that. Just getting the results slowly but surely, but making sure not to make the patient look unnatural. And again, I think that's why you have such a vast retention of clientele that will literally follow you from anywhere you go. Okay, so moving on and hitting on some topics I know the viewers will be interested in. Two-part question. I want to know, what are your favorite injectables to use? And what are the distinguishing factors between injectables, volume replacement biostimulators, and neuromodulators?
Right now, in the industry is actually moving towards regenerative medicine. And so just the same, I'm not saying I'm not using the traditional hyaluronic acid dermal fillers, but I still prefer to use biostimulators, and that would be Sculptra, Radius, or even Renuva.
Interesting. Renuva is a relatively new product. I don't think we've even scratched the surface of its applications at this point, but I think it's a viable option for anybody who is not looking to go the hyaluronic acid filler route for whatever reason, maybe isn't really interested in collagen stimulation, or needs something a little bit longer lasting and more stable, such as fat. So I think it's really great that Renuva is out there to stimulate the body's own natural fat production in certain areas. I would be really interested in seeing the application for the temples. Temples is an area that not a lot of people think of, or at least the patient doesn't necessarily ID that that's something that's causing them to look a little older. So a lot of times patients will come in and they're focused on jawline and cheeks and lips. And that's all well and good. Those areas need love too. But the temples, you cannot treat the cheeks without doing the temples.
Exactly. If you want to balance the face, you want to smoothen the transition between the temples to your cheekbone.
Absolutely.
So, yep.
What would you say your experience has been with Renuva? And can you tell the audience a little bit about what's unique to Renuva?
Well, Renuva is, first and foremost, it's cadaver fat. And I normally use it on patients who have volume loss, mid-face, temples. It's really good, but it's not for everybody. So you have to know your patient. You have to know the history of your patient. It works well for hands, neck, but you have to do certain combinations. I'm not going to mention anything because it's
proprietary information.
Yes. It gives the results of a patient where, because it's stem cells, and it's fat, it really makes your skin tighter. It gives you a glow that makes you look more natural. With Renuva, it's very natural looking. It may take a few sessions before you start seeing the results that you want, but it lasts a long time. Now, when I did say earlier that it's not for everybody, it's not. So I've come across patients who've had facelifts before. And obviously when you do a facelift, sometimes they do a fat transfer, fat grafting onto the face. And after a few months, you see a little deflation of volume on the face. And so now you can't use that on that patient.
Interesting.
Because then they'll just metabolize that cadaver fat in no time. So for me, my choice would be Sculptra or Hyperdilute Radius.
Two of my favorite words.
Yes.
Talk a little bit about, for instance, when a patient is coming in for filler, but you really feel that they might need a biostimulator such as Sculptra or Hyperdilute Radius. Tell me what might differentiate a patient from needing HA fillers as opposed to a biostimulator.
So in my experience with injectables, I've realized that if a patient is 35 and over, it is best to veer them towards biostimulators like Sculptra or Radius, because at that age, at age 20, collagen slows down in production. So by age 35, it's even slower. So at that point, you want to replace the volume as fast as you can. And
via collagen induction.
Yeah, via collagen induction, and using biostimulators will do that. It does give a better result. Now, for patients who are a little bit on the younger side, I would still recommend, and obviously want to make sure that the patient expectations are doable, right, and reachable. If they want result right away, then
hyaluronic
acid filler.
Yeah.
If they're willing to wait, they're not in a hurry, they're not in a rush, there's no waiting happening, then let's do a biostimulator.
100%. And I think it's also interesting to look at the dichotomy between biostimulators and hyaluronic acid fillers. Oftentimes when I have patients coming in and they're wanting to augment their facial shape from what was naturally given to them, hyaluronic acid fillers are great for anyone, 20 to 35. But if a patient is coming in due to like age-related volume loss, you need to rebuild that collagen and stimulate actual volumization that can last them a little bit longer than a hyaluronic acid filler can. So that's where Sculptra and Radius come into play.
Yes, exactly. And remember, it's not only volume loss, but it's also bone resorption. So
yes, the bone resorption. Don't forget the bone resorption.
Yes, and so that's when Radius actually comes in. If you want to bring the structure back, Radius is the choice. If you want to bring volume back, then Sculptra is the choice.
Yeah. And hyaluronic acid filler will always have a place in our hearts, but there's a time and a place to use everything. Okay, so our next topic. What is your favorite treatment to perform? What are you very fond of doing?
Well, I wouldn't say it's a treatment per se, but when I see a patient for the first time for a consultation, they're saying, oh, my face is falling. That's their word. My face is falling. It's not
I think
falling.
I've said that to you a couple
times. You have. You're one of them. And what I would normally say first, let's talk about your skincare. Skincare is very important because that's the foundation of everything. You can do all the Botox in the world, you can do all the dermal fillers in the world. If you don't take care of your skin, guess what? That's the first thing that other people can actually see, or even you yourself. So I always push for skincare. I always make sure that they know how to use the products that they already have.
And that reminds me of how much I absolutely love the vitamin C serum that you gave me.
Oh, yes.
Pam has her own skincare line that was in development for many years, and I could not wait to get my hands on some of the products, and you actually gave me one that you thought would be best suited to my skincare needs. Tell me a little bit about what's in that product and what makes it so special.
All right. So I've been working on the skincare for quite some time now, and I needed some test dummies, and here's one.
I'm a dummy.
And so I gave him a vitamin C and E serum
and green tea, which I love.
So it's a very powerful antioxidant. At the same time, it helps calm the skin.
And I need that.
Because sometimes vitamin C can irritate the skin.
Yeah.
But this one will not.
I never got any of that.
So it's a combination of powerful ingredients and plant-based products.
Okay, we love that. And tell the viewers, if they're interested in your products, how can they get a hold of them?
So if you are interested, obviously you can't just buy the products online because some of them are really medical grade. So you'll have to see me first. Right now, you can actually visit my website, pa-skincare.com.
That's P as in Paul, A as in Apple, skincare.com.
And you can shoot me a message there and I can ship out all the products that you would like.
I'll be sure to link her website in the description below if you're interested. Okay, so what approach would you take to a patient in terms of facial balancing? So if somebody comes in and they're interested in skin resurfacing, but you also see that they might have a little hollowing in certain areas, and that's sort of the whole puzzle, how do you bring that to their attention?
So what I would probably say first is I actually hand them the mirror.
I love that part.
And then I go in and, give my professional opinion. While they're concerned about texture and all that stuff, then I would say, okay, once you start with, rejuvenating your skin, obviously before doing any laser resurfacing, I always pre-treat. That's always important.
At-home products.
At-home products for at least minimum of 10 to 14 days.
Especially, I will interject here, especially if a patient comes in and they're melasmatic, they're showing signs of melasma and they want to treat that with laser, it's really important to pre-treat that skin to arrest the melanocyte development that's causing the melasma, but also to help mitigate it to some degree before even doing laser so there's no rebound effect. And that's one thing that you taught me when we started working together, and that was of paramount importance when consulting with my patients, was teaching them how melasma comes about, but more importantly, how to safely treat it with lasers. Because if you don't pre-treat and post-treat properly before and after laser, you can actually exacerbate the melasma.
Yeah. And if you don't, they come back with a vengeance, and we don't want that.
Well, so does the melasma, but that's another story. And one thing that I notice that when I'm consulting with patients, they might come in and tell me that their main concern is volume loss in the mid-face. And while I'm consulting with them, I'm noticing that the texture of their skin and the pigment of their skin, whether they have sunspots or melasma or something along those lines, is actually making it look more deflated than it actually is. And what I think is really important is to make sure the patient is aware of the whole picture and that they can't rely on just a filler to revolumize in those types of scenarios. It's important to let them know we need to weed out the pigment first and get rid of the shadow effect that's caused in the skin, and then go ahead and replace the volume as well. So these treatments are sometimes multi-layered.
Yes, exactly. And, when I look at patients, and especially if I'm already doing the procedure, for example, if I'm doing an injectable treatment like dermal filler, and I'm really close to their face, and I always tell them, hey, what do you use? What are you using on your skin right now? Because I would notice certain things on their skin that I know bothers them, but right now their focus is into fillers. And so that's how I kind of like get it on the priority list for them.
Okay, so I kind of want to switch gears into safety protocols. I think these are extremely important, especially when talking about fillers, but certainly lasers as well. So what type of safety protocols do you observe when treating a patient for fillers and also laser?
First and foremost, as an injector and as a nurse, is to really know your anatomy.
Yeah.
And even though you know your anatomy very well on the books, every patient is different.
Yep.
So, especially the ones who've already had surgery, they're not the same.
Their anatomy has been shifted around.
Yep, it's been shifted around. So that's the most important thing, is really, by heart knowing where the arteries are. When I inject, I always feel. I always feel
Yeah, I
for
know.
the
I've
pulses.
noticed.
I always feel,
You're getting me a massage the whole time.
yeah, I always feel where I'm at and making sure I always aspirate in certain areas.
Tell the viewers about aspirating really quick. I don't think people are aware that this technique can actually really help to save them from an occlusion.
Yeah, so aspirating prior to injecting the product. So the provider is already in the tissue. Before injecting the product, you need to aspirate. I do it twice. Because when you inject that, then it can cause a lot of trouble for the patient and for you.
Yeah, of course. So you're saying that once you're in the skin with a needle, before you actually inject the product of your choice, then you're actually aspirating by pulling the plunger outward, just to make sure you're not seeing any blood, meaning you're not in an actual artery.
Yes.
Awesome. That can actually help stave off an occlusion or a vascular event. And that's just one of many tricks in your bag, correct?
Yeah, that's one. And then also another thing would be using a cannula.
Well, tell the viewers the difference between a cannula and a traditional needle.
Okay, so the difference between a cannula and a sharp needle. A cannula is a blunt tip needle. So it needs a sharp needle to create a port in the skin so that you can actually put in the cannula. So you can just go over on the tissue safely. And it's easier to navigate the tissue with a cannula and not really maiming the tissue of the skin and creating bruises and swelling.
Right. I think it's also important to note that the cannula is bendable and it's more malleable than a straight edge needle.
Exactly.
So you're not actually puncturing veins and causing excessive bruising, swelling, or getting into an artery as easily as you can with a sharp needle.
Yes, correct.
Right. But to my understanding, not all injectors are well versed on cannula usage.
I think right now there's more and more who are starting to train to use the cannula. It's easier. It's a little bit safer. And even though, some people might think, well, I'm using a cannula, I don't need to aspirate.
Yes, you
still
do.
Should.
Yes, you do.
You still should. Even if we know the anatomy inside our heads, we don't have an x-ray vision that it can actually see the inside of a patient's face. So just to be on the safe side, you always want to aspirate.
And what type of safety protocols would you implement when treating a patient with energy-based devices such as laser skin resurfacing or laser hair removal and so on and so forth?
Well, the first thing you need to know is your patient's Fitzpatrick type. So it's skin type 1 to now there's a 7.
Yep.
And, you really need to be careful about skincare types 4, sometimes 3. So 4 to 7, you need to be careful. And as far as like cautionary measures, pre-treating. Pre-treating is important, and then explaining to the patients the procedure, how it works, what they need to do before and after. Obviously, let's say for someone who is going to do a resurfacing laser, for example, and they want to do it now, but then they just came from a vacation from Hawaii, we're not treating you. We're going to wait 2 weeks before we do any laser. And after that, you want to wait at least 2 to 3 weeks before you go out in the sun. And when I say go out in the sun, it's not like, oh, I can't walk my dog. I can't, go run errands. You can. What I meant by going out in the sun is like laying out.
Intentionally trying to go out in a can of
direct
tan.
sun exposure and that's a no-no for laser resurfacing.
So you would say ideally you would assess their skin type. For instance, a Caucasian such as myself is going to have different power settings with a laser than say yourself, an Asian patient. And that's something that's really important is when you're a provider, you need to make sure that you understand the different applications and power settings for a laser applicable and conducive to a patient's skin type. Okay, Pam, tell us a little bit about what trends that you're currently seeing in the market today and what are your favorites? You know our industry's trendy.
Yeah, it is, and it's it's a multi-billion-dollar industry. It's continuously changing, but I think the ones that are trending but have been around for a while is regenerative medicine.
Yeah, I think
and those
it's
are
resurging.
Yeah, yep, it's resurging. So Sculptra is making a big, huge comeback.
Yeah. As is Radius.
Yeah, as is Radius, and I think because right now more and more people are wanting natural results.
Right.
And with that particular product, you get your natural results because it's your own collagen that we're trying to build.
Yeah.
And I love that, and it's for everywhere, for someone who has some problems with their neck and they want to tighten the skin there. What I would normally do, I kind of layered it with other procedures. So I would say, let's do Morpheus, on the neck, to tighten the skin, and then come back 2-3 weeks. Let's do Sculptra with Renuva. It makes a big difference. And it actually makes the results show up faster than just waiting for an
the Morpheus alone or an injectable. Absolutely. Yeah. I think layering modalities is extremely important. And pivoting the conversation when consulting with patients, I think is really important as well to help them understand Morpheus or any laser for that matter, or any modality of treatment. It's not a one size fits all. It's not going to fix all the problems. I think the industry kind of took a turn at one point in time by stating this laser is going to lift, tone, build collagen. It's going to do all the things. And while to some degree that may be true, depending on the patient and the settings that you can provide them, it's not always going to give them everything that the company promises, right?
Yes.
I think layering modalities is extremely important and going to a provider that understands the different efficacious factors for each modality in its own right.
Yes. It's really important to know that your provider understands, how lasers work, if they can combine them, if they can layer them. And also the most important thing is understanding understanding your skin type, understanding your needs, understanding your expectations. It's really important to know that. And it's not all about like, okay, this is a laser, the new laser we have at work, and we're trying to promote it, so I'm going to be using it on you. It's not that. Like, to me, I think what makes my patients come back to me is because I'm really honest about what they would need. If they don't need it, I tell them, no, you don't need it yet.
That's a really good point.
It may sound like a cliche, but it really makes my heart kind of, beat a little bit more if I know my patients are happy about the result.
That's actually a really great point that you brought up. I've actually worked at certain clinics that have reprimanded me for not selling what they wanted me to sell, and they would set goals for me and I would shy away from them. If the patient didn't need it, I'm not gonna recommend it. And a few times I got verbal warnings and written warnings regarding me not selling enough of the device that they just spent a lot of money on, but that burden is not on myself or the patient. It's always important for me to sell the patient something that's actually going to benefit them. And I think that's one big distinguishing factor when I met you, is you do the same thing. And I really appreciated that about you, and your patients appreciate that as well.
Yeah, and I was just going to say that too. And I think that's why we mesh well, because we have the same goal. And, one doctor even told me before that, I need you to sell.
That's not your job.
No,
your
and
job
I said,
as a provider.
Yes, and I did tell him, I said, well, I'm not a salesperson, I'm an educator. I'm a nurse and an educator. And to me, if you call it selling, but I educate my patient on what they need at that time, and if when they want to do it, or what's the first thing that they need to do. And I think that's why JJ and I kind of really mesh well. And I think, like, I even told my husband, like, okay, yeah, my work husband is JJ, because we work well together. And I really, really, really appreciated that we're just harmonious.
Yeah.
When it comes to patient care.
And it's been like that in and out of our working relationship.
Yes.
So I know that you're extremely educated on a vast amount of the laser platforms that are out there today, but what are some of your favorite laser platforms right now?
CO2.
You love CO2?
I love CO2.
Yeah.
Fractional CO2 is, I think, the grandfather of all lasers. Obviously, it's not for everybody.
Sure.
But there's this new CO2 laser that is supposed to be for everybody.
Ooh.
So I can't wait. And one of the patients that I'm going to be using is this guy right here. So, So it's a, CO2 is a very powerful laser. And if you're trying to address, really deep wrinkles, texture issues, and even color, then that is the laser for you. Second to that would be the Halo and BBL platform. He knows that I love them.
Yeah.
I love that laser.
Tell them a little bit about the Halo.
So Halo is a fractionated laser, and it comes in dual wavelengths. It delivers the energy at the same time. So it's not like the fractionated CO2 where you have to do them separately.
Mm-hmm.
This one, you're doing them together.
So you're getting dual wavelengths at the same time,
at
is
the
what you're
same
saying.
time.
Tell the viewers a little bit about why would they want two different wavelengths simultaneously being used at the same time on their skin?
One of the things is that it actually will help with the downtime. So it's less downtime if you do it that way. And at the same time, you want to do ablative and non-ablative platforms. And that's with Halo. So it helps with tightening. The deep helps with tightening. It restructures the matrix of your skin. So it builds more elastin and fibroblasts, which helps with plumping the skin and tightening and lifting the skin.
Yeah.
At the same time, all that is happening on the deep level. On the surface of the skin, you're removing the texture and color, like hyperpigmentation and even skin tone. And because you are combining it with broadband light laser, you're also addressing certain conditions like rosacea. If the patient has some redness, some acne,
broken
as well.
capillaries.
Yeah, broken capillaries. So it's a very well-versed, I would say you're doing the whole shebang when you do this laser.
Halo and BBL. You're really good at that treatment, actually. I can't name names, but there are a few people that rant and rave about the glow that they have after you've treated them with that platform. And again, specifically you, because they did make a point to differentiate having treatments with other providers that may not have been as well versed as you are, but then once treated with you, they never left your side.
Well, I think, again, I'm going to push for the pre and post care skincare treatment. It really plays a big role when you want your results to be phenomenal. You want to make sure your skin is healthy.
But I also would say that what I find really helpful about pre-treating, and when we say pre-treating, we're talking about very specific topical products that the patient will use in-home, whether they're prescription strength or medical grade, either or a blend. Once they attain the goal with the pre-treatment, which can last anywhere from 4 to possibly 12 weeks of pre-treatment, depending on their skin type and their overall goals, you're able to recalibrate the settings and do a deeper treatment on them because they've pre-treated properly and their skin is now conditioned to receive the laser at a higher power output than without. So it's actually a better investment long-term for them to pre-treat and post-treat properly and adhere to the laser protocol as you depict it to them.
Yes, exactly. The reason why is because now your skin is healthier and it's responding better to the treatment and it's healing faster. And not to mention, if you apply exosomes after that, it just makes it even better.
Now let's dive into your favorite condition to treat. What condition does a patient come in with that you're most excited to treat?
Favorite condition to treat? I would say texture.
Me too. I love treating texture.
Yes, like texture and tightening and color. I want the skin to have that glow back. I want to improve skin texture. I want to smoothen the skin. That's what people see, and that's what you see every day. And like I said before, you can put as much Botox and filler in the face. If your skin is not good, it won't matter.
Right. I agree with that. Absolutely. I think one of my favorite conditions to consult on with patients is texture. Even if it's acne scarring, it doesn't matter to me personally. I find that texture is, although not the easiest thing to treat, there are tried and true energy-based devices that I know will give them the resurfacing that they're looking for and the tightening and the collagen. It's so amazing to be able to walk with the patient through that journey and have them see from start to finish how much of a difference that we were able to make for them.
It actually gives you an opportunity to try everything else that you have in your clinic. You have to remember when you're treating an acne scar patient, every time you do laser or any particular procedure on that patient, the next time that patient comes to your clinic, that scar is different. It's not the same. So it may start as like a deeper box scars, like ice pick scars. After a treatment of a CO2, the next time you come in, we normally see them in 2 to 3 weeks, it's going to be a different type of scar.
Right.
So then it doesn't have to be the same laser you have to use all the time. You can say, okay, right now we could probably try microneedling with radiofrequency. Or maybe, let's do a little peel, maybe a TCA peel.
There's one patient that comes to mind that I've seen you treat with so many various platforms for resurfacing this particular type of acne scarring. And it was extremely deep and very visible. And I've seen you use microneedling with exosomes, microneedling with PRP, fractionated CO2. I've seen you use Morpheus on this patient. I've seen all of the different iterations and their skin looks amazing now.
Yes, and I'm really, really happy about that. I can't say enough. Like when I see patients' skin in their journey, like I'm with their journey the whole time, it just makes my heart full. to see that the patients are happy and their skin is way much better than before.
And what are some general post-care tips that you can give our viewers regarding post-injectables and post-lasers? And I know that every patient is unique and there's very specific protocols to be observed per skin type. But what are some general tips and tricks that you can give them to improve the longevity of their result and also make sure their healing process is expedited as much as possible?
So when it comes to like, injectables, I would normally say just hydrate the skin, making sure you're using the right moisturizers, lipids, peptides, those are really good ingredients to have. So you really want to make sure that you are well hydrated and moisturized. That's very important when you're doing injectables. As far as laser resurfacing or any form of energy device, follow the skincare regimen. I would say use prescription retinol, tretinoin, or whatever you prefer, but it has to be medical grade. It has to be prescription. The ones that are over the counter, there's nothing wrong with it, but it won't give you the effects that the retinol would really do. And it will take a long time for you to see results. Those are the things, and also combining a chemical exfoliant. Retinol and glycolic are just my favorite skincare to have because it keeps your skin smooth. It helps your pore size.
Right.
You don't have brown spots. It just clears your skin. And having a very strong skincare regimen is important to me.
I agree, before and after. Important to note, however, these more stimulating topicals should be avoided for a minimum of 2 weeks before and after laser,
yes.
unless your provider says otherwise.
Yes, no, that's true. For certain skin types, you want to stop using those acids or strong ingredients at least 3 to 5 days before, and then you can restart using it when I tell you to.
Yes, exactly. So we've talked a little bit about your approach when it comes to consulting with your patient, but what can a first-time patient expect when they're coming in to see you?
Well, first-time patients would expect like a full holistic approach of, when it comes to consulting and assessment. I always go over the skincare. If they already have a skincare, I ask them, okay, do you know how to use them, or tell me how to use them? Because that's actually when the patient does not know how to use their products correctly. And that's why they're not seeing the results that they were expecting.
They might be mixing certain products that don't really like each other.
Or they're using retinol in the morning. So I've had patients who've used retinol in the morning and they're like, I'm always red, I'm always dry. It's because of that. So, I always see my patient as a whole, whether or not they came for just injectable, I always want to educate. If they're already doing injectables like botox or neurotoxin, at an early age, then they would definitely need some help when it comes to taking care of their skin.
Absolutely. I think making sure that their at-home regimen is up to par is almost as important as their in-clinic visits, because eventually when they come in to see you for their in-clinic service, you want them to make sure to maintain those optimal collagen levels, elastin, as well as the resurfacing at home. That way they're not relying so much on your treatments.
Yes.
What are the most common myths or misnomers that patients bring to your attention when they're consulting with you about particular platforms or treatments or the industry as a whole?
I think there's actually two that come to mind. First one is when it comes to injectables like neurotoxins and fillers. Most people interchange them.
Yes, I've had people talk about Botox in the lips, but really referring to lip filler or something of that nature.
Yeah, that's one. So I have to you educate the patient and show them and explain to them the difference between a neurotoxin versus a dermal filler.
Sure.
So that's the most common one. The second one is for the Morpheus. When they say, I don't know if you would agree with me or not, that it can cause fat loss. And yes, it can if you wanted to.
Right.
If you go to a certain depth and a certain energy level, it will melt your fat. However, if you are well aware of how the machine works and you know what your patient wants and you know what your patient skin type is, you don't go to that level to burn fat. If she wants tightening and lifting, then you go to that level. You don't go over 3 or 4 millimeter deep.
And I think it's also important to note that not every quadrant of the face is going to have the same settings either. In a larger sense, it's not a one-size-fits-all in the first place, but certainly it's not a one-size-fits-all. Even if you do look at assess a patient's skin type and you're like, okay, to avoid facial fat loss in this quadrant, we want to make sure that we have these settings. That setting for the cheeks is not going to be necessarily the same for the forehead.
Yes,
right?
exactly.
So, and somebody like you is able to quickly assess that in your patient and then readdress that and calculate that into the platform itself to make sure you're giving a very uniform treatment with no adverse side effects. aesthetics.
Yes, that's true. And then also too, when you do those particular treatments, it doesn't mean when you do one session, you're going to see the tightening already. Like what we talked before, it takes 8 to 12 weeks or 60 to 90 days before you start seeing collagen build in the skin.
Right.
And that's why I always tell my patients, yes, you want to do at least a series of 2 to 3, and depending on really what your goal is. And I want to see them between 4 to 6 weeks. And the reason behind that, I want to build collagen on top of collagen on top of collagen.
And keep the fibroblasts stimulated consecutively.
Yes. So you want to make sure that all of those things are happening at the same time while you're doing the treatment. And the series of 3 will get you to where you want to be. And after that, it's just maintenance.
I also want to note that a lot of these different energy-based devices, Morpheus is no exception, have different tips that are interchangeable with the handpiece. So for instance, a patient might come in and want tightening, and there is going to be a specific tip for that. And I've also worked for some clinics and practitioners that use multiple different types of tips on one patient. So there are many, many different ways that you can customize these treatments for the patient, varying from the actual energy output to the depth to the type of tip that you're using.
Correct.
So give us a history lesson. How has the industry changed for the most part within the last decade?
Well, in the past decade, the industry has evolved immensely. It's pivoting towards a lot more regenerative medicine, biostimulators, and not just the industry, but also the people in it. Like the patients are actually more open to like doing less injectable procedures.
I think that's because they know more now.
Yes.
And I think, I've noticed a really big trend, and it has a lot to do with social media, is patients are coming in pre-educated. But there's a lot of patients back in the day that used to think they were already educated. They would come in and tell me or tell the provider, this is what I want and this is how you're going to do it. It more times than not resulted in a subpar outcome. But now I find that patients are already pre-consulted, which is really nice. Like they have a base understanding of the different types of lasers, the different type of injectables, and it's made my job a lot easier.
Yeah, no, it's patient education is really important. So it's also good, and I really advise patients to do your own research before seeing a provider, and obviously research your provider, vet your providers. That way you know that you're in safe hands.
Right.
And I think that's one of the biggest change is that information.
Agreed.
The patient is now well informed of the procedures, the products that are being used. There's still some that are kind of left behind, but for the most part, they're well versed with what we do now, and then they already know what they want. And less is more.
Sure.
Actually, non-surgical BBLs still, trending.
I'd say it's upticking.
Yes, because they no longer want that big butt.
Yeah.
But they still want the natural, a little bit of like a lift in their
a little lift, a little more volume on the hip dips, and just making it look more cohesive versus just blowing it up to the nth degree.
Yeah.
So I find
perky,
a little more luscious.
Yeah. There you go.
Do you have any advice for any would-be nurses out there that might be looking into dipping their toe into the world of aesthetics and how they might look at getting started, or how would they approach that?
I would say, if you're interested in aesthetics, start with dermatology. Start with the skin. Understanding the skin, understanding the anatomy, understanding the functions of every layer of our skin. It's really important. And then from there, move up to lasers, then move up to injectables. I'm so thankful that I did it that way, because when I see my patients now, I look at them as a whole. I don't look at them like, oh yeah, you're just volume depleted here. If they have questions about certain things, I can answer.
Sure.
Because of my background and my training.
That's what makes you such a well-rounded provider, as opposed to just very specifically trained by maybe the makers of a product such as Juvederm or something, where the trainers come in and they're doing their jobs and they're training you, but you're so focused on just completing the ABC 1, 2, 3 technique for whatever area that you're filling versus looking at the patient as a whole and fully embodying what it is that they want done.
It makes the journey of the patient really easier. And at the same time, as a provider, like you see your finished product makes you proud.
Yeah. And the patients are happy.
Yeah.
What are some tips from your side of the fence in terms of choosing the right aesthetic provider?
I would say first and foremost would be the number of tenure in the business.
Sure.
Second of all would be the knowledge, anatomy, the products they're using, the knowledge in biology.
Sure.
It's important. Those things should go together. And at the same time too, you want a provider that actually understands your needs. and
Agreed.
not just
And is listening
what they
to
want.
you.
And it's listening to you, correct?
Within reason, making sure that, you know, if the patient's veering off in the wrong direction, asking for A when they really need A and B. But yeah, certainly listening to the patient and not just doing whatever they want.
Yes, exactly. And you know what? I would say I would include this. If you find a provider that actually says no to you when you asking them to do a specific procedure, or you want more of this particular filler, and if they say no, you're in good hands.
Yes, I agree. I tell patients no all the time.
Yeah, no, it's, you know, when the provider says no, it means you don't need it. And now you can understand I'm in good hands because she knows when to stop. She knows when to do a procedure. She knows when to put more filler in me. And if they're like that, then you're going to remain natural looking.
Agreed.
I mean, that's what we say. Like, I want Botox done. I want, you know, fillers done, but I want to look natural. It's still organic, you know.
It also means the provider's not so sales focused.
Yes, correct.
I'm going to shoot off some questions.
Okay.
And I want your answers. So what is your favorite treatment to perform?
Favorite treatment to perform full facial rejuvenation
Via
neurotoxins and dermal fillers. Like I like do that because
it's immediate.
It's immediate
to some degree.
Yeah, to some degree it's immediate, you know, and I like that, you know, as I'm injecting, I see the transformation of the patient, and then when they're done, they look at the mirror and I'm like, oh my gosh, you know, it's so good. That's what I like, and I feel like even my patients can tell when I'm doing them. They're like, I can tell you're enjoying this, Pam, and I really do. I really do.
Yeah, no, you exude this type of energy and aura when you're doing your treatments. Yeah. Okay, what is the most underrated skincare ingredient?
Lipids, because for my age, I'm starting to lose some of those volume and my skin is different. You know, I'm not like when I was in my 20s. I love lipids on my skin because it pumps it up and it speeds up the collagen stimulation and it keeps me hydrated.
Yeah, I agree. I think that is an underrated skincare ingredient. Ceramides, lipids. I feel that certainly for people like myself, I'm constantly breaking down my stratum corneum, my outer layer of skin, breaking it down to resurface, restructure. But the ceramides and lipids go along with that. And so replenishing is important for optimal skin barrier health. Yeah. I think ceramides and lipids are being talked about, but maybe not nearly enough because they're not as flashy as collagen-inducing peptides and hyaluronic acid instant plumping and things of that nature. But the moisture barrier that lipids and ceramide provides is so important because it seals everything in and it keeps the top layer of skin at optimal performance. What is your go-to skincare product?
I love my glycolic acid.
You do. You really like it.
I do. From head to toe, I use glycolic acid on my face. I use glycolic acid on my body. And I think another thing would be exfoliating with a physical exfoliant, like scrub, you know, like crystals. And it's really...
crystals, diamonds, pearls, whatever is handy.
Yeah, whatever's right there, okay? It just makes your skin really clean and supple and smooth.
Sure.
And it's something that I can't really live without.
Yeah, you love a good glycolic. Yeah, she's constantly trying to shove glycolic down my throat. It doesn't really interact with my skin as well as it does other people's for whatever reason. I do use glycolic, but I have to be very careful about where it's derived from.
Yes.
Or I'll break out.
Yeah.
Is there a most memorable patient story that comes to mind?
Oh my gosh, yes. It's very memorable. She is one of my injectable patients that turned into a CO2 patient. And she was a single woman. You know, she wants to go out there and meet her man, and she wants to improve her texture. She looks great for her age. She left a review actually on my previous job, and it was just very heartwarming because she was very happy with how I transformed her face. I evened out her lips, and she said, you know, no doctor or provider has ever done that, which is neurotoxin. And you know, after CO2, her skin was just amazing, and it almost looked like she lost 10 years.
Yeah.
She went back 10 years in her age, and she was very appreciative. That's one of the stories, and she was always referring patients to me. So
that's a good sign of a good provider.
Yeah.
Okay, so switching gears here and sort of winding down, where can the viewers find you?
Well, I'm in 2 locations here in Los Angeles. I am in Santa Monica at Ocean Aesthetics, and I'm also at Aesthetic Republic in Beverly Hills. You can make an appointment or slide a text message at 310-704-7302.
And are there any fancy social media platforms that you might be featured on?
Yes, well, I have my, you know, Instagram account, and it's at Pamela Anderson Aesthetics.
And do you have any upcoming projects, trainings, or specials going on?
Well, our clinic in Santa Monica is actually being renovated. So we will be reopening between August and September. So we will be shooting some nice goodies and also some packages for patients to visit. So we're going to have an open house. We're going to let you know. We're going to put it on our Ocean Aesthetic Instagram account.
I can't wait to see the new space. And what's one word of advice you'd like to leave for the viewers?
So, for the patients, my advice is to, do your research and vet your providers before making an appointment. That way, you'll have a happy outcome. And for the providers, just like me, if you want to get into aesthetics, I would say, make sure that you have your heart in the right place and that you really, surely enjoy what you do, because then it's not work. It's actually fun. I love my patients. I have patients that are like friends and family to me, and I would love for patients to have that experience too. So if you do love your job, if you want to be a nurse, you have to have the heart for it.
No, I agree. And I think that you embody all of those aforementioned tips and tricks.
Thank you.
Yeah,
Thank
you're
you.
you're a great provider, but you're also a great person.
Thank you. I mean, I try.